Trans people have told ITV News of their often agonising wait to get the health care they need, with delays of more than 5 years just to be seen for the first time at the region's only gender identity clinic for adults.
Waiting times there are more than 15 times longer than the NHS target, causing anxiety and delaying what many call life-saving treatment. Lucy McDade has been hearing the story of one person from Gloucester affected by the long wait for help.
For most of her life, Amber knew she didn't belong in her male body. Finally, a year ago, she came out as a trans woman. She now takes estrogen and hormone blockers to restrict her body's production of testosterone. But until she can get to a gender identity clinic, she can't have the surgery she needs to complete her transition into a woman. She knows it could be years before she gets an appointment.
It's kind of a double-edged sword, really. I'm happy to be on the waiting list, but knowing how long it takes and the fact that you don't get any sort of interim conversation with the clinic at all until it is that time is quite frustrating as well. But it is something that I need to do for me, to be completely and honestly and truthfully who I am.
In England, there are 7 established NHS gender identity clinics for adults. There's one in the southwest, and that's in Exeter. NHS guidance says people shouldn't have to wait more than 18 weeks for an assessment, but they're currently waiting more than 5 years. Kit from Bristol is one of those.
Any healthcare situation, if people are having to sit on waiting lists for an extended period of time, then there needs to be more provision. The numbers of trans people that end up taking their own lives is horrifying. And so many of them, it's because they can't access this care.
Since ITV News started looking into these delays, others have got in touch. At his request, we're hiding Ash's identity, but he wanted to highlight just how damaging the waiting times are. So much so, in fact, he's now paying for private treatment.
Had that not been available to me, I don't know what I'd have done. And that's one of the reasons I reached out to you, because not everyone is in a position to be able to pay that money. It breaks my heart personally to know that there's going to be people out there feeling like that and there's nothing they can do about it.
I've spoken to people at different stages of their journey to accessing gender-affirming healthcare. All of them agree on one thing, that it can be life-saving. In Amber's case, the alternative was unthinkable.
I didn't need to sit and think about it anymore. The thought process that I had was, if I don't make this change in my life now and be true to myself, I'm not going to be around for much longer.
And Lucy is in our newsroom for us this evening. Lucy, do we know why people are having to wait so long before they can start treatment?
Well, both the NHS and the government gave us the same reasons when we approached them for a response. The first is that today more people are coming out as transgender, so more are going to their doctors and asking to be referred to these clinics. The second, they say it's really difficult to recruit the specialist staff needed to work in these clinics. Both at least appear to acknowledge that it is a significant problem and that more needs to be done. The NHS told us it apologises for the waiting times and says they wish they could see more people more quickly. The government said it's also committed to reducing the waiting times. We found out that they are in the process of opening 3 new clinics, unfortunately none of them in the West Country, and hopefully to better staff them in future they've got higher educational courses for people who want to study gender medicine. Now I do just want to stress just how great the demand is for this healthcare and for this one clinic in the southwest. When we first started looking at this in October, there were just over 2,500 people on that waiting list. Well, in the past 6 months, that's gone up by almost 200 people. So unless something quite significant is done to reduce the waiting times, the transgender people in our region will be waiting for this, what they call, very life-saving treatment.
Lucy McDade, thank you.
You're watching